14 things you need to know before starting Invisalign. There are many of us out there that may have crooked or out of place teeth. This could be a cause for concern as it knocks your confidence and can lead to many health problems down the road. Traditionally, there's an easy solution to this problem, which is braces. The problem is, a lot of people get even more self conscious when wearing braces. Traditional braces are made from metal wiring and can stand out a lot on you. There's a great alternative to braces that's really picking up a storm lately. Invisalign is just like braces. It's a treatment used to help straighten your teeth. The difference is that it uses clear plastic retainers instead of metal brackets. In doing so, it means you don't look like you're wearing braces at all. It's invisible. So you get the benefit of straightening out your teeth without the self-conscious feeling of wearing metal braces. If you're interested in having an Invisalign treatment, here are 14 things you need to know before starting Invisalign. Number 1. Keep your aligners in as much as possible. The first tip is simple. You need to keep your Invisalign aligners in for as long as possible every day. This is the only way you'll see results, and the best way to see fast results. It is suggested that you refrain from taking them out at all unless you have to brush your teeth, eat, or drink. Once that first 2-day period is over, you should still aim to keep them in as much as possible, about 22 hours a day minimum. The longer you have them in, the better it will be for your teeth. Plus, you'll start noticing them less and less if you keep them on. It just feels like you have nothing on your teeth, which means no cause for discomfort. Number 2. You'll need to adjust how you speak. One of the only drawbacks with Invisalign is that it can affect your speech. When you first put them on, you'll have a bit of a lisp. It's important to prepare yourself for this so it won't shock you as much when you talk. There's nothing you can do to prevent this. It's just a natural reaction to having these things in your mouth. However, it's worth noting that you won't have a lisp the whole time you wear them. It will only really be in the first few days as you get used to the change. Don't be tempted to remove them when talking to others. If you keep taking them out, you'll always have speech problems when they're in. So it makes more sense to just prepare for the lisp and get over it as you wear them. Number 3. Invisalign treatment length varies for each person. Before you start Invisalign, you should probably know how long the treatment is going to last. On average, it can last about a year for most adults. Of course, this all depends on the state of your teeth and how much work needs to be done. If your teeth are just slightly misaligned, or if there are just 1 or 2 teeth out of place, then it might last less than a few months. Likewise, if your teeth aren't in great shape, it can last longer. Number 4. Results are faster than metal braces. One of the great things about Invisalign is that it doesn't take long to see results. In fact, most people see them after a couple of months. But this only happens if you revert back to point number 1 and keep your aligners in for as long as possible every day. Number 5. Remember to floss. No doubt your dentist tells you to floss every day whenever you go and visit him. Do you do it? I think we can agree that very few of us actually floss every day. It seems like a chore, and we decide not to do it because we're not in the habit. With Invisalign, flossing is more important than ever, as you really need to keep your teeth and gums as clean as can be. When you don't floss, there can be a buildup of food, plaque, and other such things between your teeth. This becomes problematic as it can rub off into your aligners. Consequently, you could get this gunk stuck in the aligners, which means they don't fit your teeth as perfectly as they should. This leads to pain, which no one wants to deal with. Number 6. Set aside some extra time for daily dental care. Normally, we can get away with a short dental care routine that lasts a couple of minutes. If you're in a rush, you can brush your teeth for 2 minutes at the start of the day and 2 minutes at the end, and that's it. But with Invisalign, you need to set aside a little extra minute or two as daily dental care takes longer. For one, you have to brush and floss more often than you would without them. Every time you eat, you need to give your teeth a brush and floss. This is purely because the Invisalign will cover your teeth and keep them covered in whatever you just ate. So you could have sugar stuck to your teeth for hours on end if you don't brush before putting the aligners back on. You can't afford to miss any steps during your dental care routine either. As a result, it could take an extra few minutes, and you need to plan your day so you have enough time to fully clean your teeth. Number 7. Remember to clean your aligners. This is such a big tip for anyone considering Invisalign. As well as looking after your teeth, you should also look after your aligners. They need to be cleaned every day, just like your teeth. Cleaning them is so easy. You just use your toothbrush and clean them with some toothpaste every morning and evening. Number 8. You can't eat with them on. Sort of. It shocks a lot of people to know that there's a diet you should follow when you use Invisalign. Don't worry, this isn't some crazy diet that will completely change your lifestyle and make you lose tons of weight. It's more of a list of foods you can and can't eat while wearing your aligners. Keep in mind that metal braces also have food restrictions, but with Invisalign, you can always easily slip off your aligners while you eat, which makes it so you actually can eat anything you want. Just don't eat while you're actually wearing them so you can take care of them. It's also important to drink lots of water during this treatment. Water is already the best liquid for your teeth, but it's also so needed when you wear aligners all day. Your mouth gets dry quickly and can feel uncomfortable at first, but there's nothing a little bit of water can't fix. Drink regularly and you'll find it a lot easier to straighten your smile with the aligners. Number 9. Invisalign can help whiten your teeth. The main aim of Invisalign is purely to help realign your teeth and get your smile looking straighter, but as a happy side effect, it can also help whiten your teeth. This goes back to what we said about Invisalign keeping things on your teeth. Well, if you brush with a whitening toothpaste, all the whitening agents will stick to your teeth and not get washed off thanks to the Invisalign. Focusing on from this, it can also help protect your teeth from cavities too. Again, this is because the fluoride in toothpaste will stick to your teeth and not get diluted down from drinking water. Number 10. You can get attachments to speed up your results. Sometimes you may be given attachments that can help speed up the results. These are commonly referred to as Invisalign buttons. They're not for everyone, so your dentist will talk with you about them at your consultation to see if you need them. Essentially, they're little things that are attached to a tooth and the Invisalign tray. The aim is that it helps speed up the movement of that particular tooth to get it in line with the rest a lot quicker. They don't stand out, so no one will notice them, and they can help you see quicker results. Number 11. There's no age limit for Invisalign. Some people think that there's an age limit with Invisalign treatment. However, there's no evidence to suggest that this is true. People of all ages can enjoy the benefits of Invisalign. Number 12. You'll need a retainer. Invisalign is a revolutionary treatment in that it can quickly yield results and hardly anyone will notice you're wearing the aligners. However, as with braces, the work doesn't stop when the treatment is over. Invisalign will do an amazing job, but it's up to you to ensure that it stays that way. You'll get a retainer fitted for your newly aligned teeth, which you have to keep in every night afterward. Too many people forget to do this, particularly after having braces. As a result, their teeth slowly start shifting again. The good news is, when you have Invisalign trays in your mouth for a year, you tend to get used to the feeling, so sticking a retainer in before bed really doesn't feel strange to you and can actually be rewarding knowing your smile is going to stay amazing. Number 13. Adjustments may be made to your teeth. It's worth noting that some minor adjustments may be made to your teeth before your treatment. Again, this will be discussed at your consultation. If your teeth are too big, they can get filed down slightly so they can fit in a tray with the rest of your teeth. Don't panic. This isn't a painful procedure at all, and it will only help you get more from your treatment and have a better-looking smile. Number 14. Cost varies per person. Knowing the exact price of your Invisalign treatment can be difficult. It varies from person to person and is usually cheaper if you've had braces before. Most patients can get all of their desired results for just $3,000 to $5,000. The results that patients enjoy after their treatment are so astounding that patients are always grateful that they had the opportunity to use them. Additionally, many insurance providers cover Invisalign treatments, so you'll be able to enjoy your new smile easily and quickly. So those are the 14 things you should know before having an Invisalign treatment. Invisalign is a great treatment, and it can help bring back confidence to your smile. If you found this video helpful, make sure to hit that like button and share this video with someone who might find it useful. Thanks for watching, and see you again in another video.